Hi everyone, Dr. Luke Pedersen here, physical therapist with the Knee Replacement Therapist. For this video, I want to talk about dental care and dental procedures following your knee replacement surgery. So there's a lot of different viewpoints and opinions related to different aspects of care when you have a dental procedure after a knee replacement. So the traditional thought is that one, you want to avoid any type of invasive dental procedures for 8 to 12 weeks following your knee replacement. Additionally, your dentist and your surgeon will recommend taking an oral antibiotic, prophylactically before any type of invasive dental procedures. Now, they might recommend this for up to 1 year or 2 years after your knee replacement surgery. Some will recommend this for the rest of your life after having a joint replacement surgery. Now, the reasoning for this is with any type of invasive dental procedure, there is the risk of bacteria entering into your bloodstream, also known as bacteremia. And when this bacteria enters your bloodstream, theoretically, this bacteria can travel through your bloodstream, travel to your prosthetic, your new replacement, and cause an infection in the joint, which of course can lead to all sorts of problems, including failure of the prosthetic and needing a revision surgery. Now, the thought is that the potential adverse effects of having an infected joint and treating an infected joint would lead to the recommendation that prophylactic antibiotics should be taken before any type of invasive dental procedure to avoid infection into the joint. However, these recommendations from different associations and societies have changed over time. And the reason for this is that the evidence to support this using these antibiotics prophylactically is actually lacking. So, for example, the quality of the evidence is unconvincing, and the studies that show an advantage of taking an antibiotic prophylactically really shows minimal or no statistical advantage of this. Now, what there is shown in some of the research is that taking an antibiotic can decrease your risk of getting what's bacteremia. And bacteremia, again, is bacteria entering into the bloodstream. So taking an antibiotic can reduce this risk with any type of dental care. Now, something to keep in mind is with certain daily activities, such as brushing your teeth or chewing on something, can lead to this bacteria entering into the bloodstream and possibly has a greater risk from these daily activities than your actual dental care that you're receiving. The other thing to keep in mind is that the correlation or the connection between this bacteremia and actual joint infection is poor. There's hasn't been shown that there's a correlation or a connection between these. So people may develop bacteremia, the bacteria may enter into the bloodstream, but there hasn't been any research to show that there's any increased risk of developing a joint infection, an infection in any of the prosthetic joint replacement. So the guidelines and the advice and recommendations from these different orthopedic associations and dental associations have now changed to more of this practice of taking an antibiotic prophylactically isn't necessary. And instead, they really say that, you should just have good oral hygiene, good oral health, both before surgery, before your knee replacement surgery, and after your knee replacement surgery. And they also recommend, if you are someone who you might be at a greater risk for developing a infection in your joint. So, for example, if you're someone who has, you want to consider the time frame from when you had your knee replacement to when the dental procedure is going to take place. You want to consider the type of dental procedure you're receiving. You want to consider if you have a compromised immune system for any reason, or if you have a history of the joint being infected or a joint replacement that's gotten infected. These are different reasons why it might be prudent to still take an antibiotic prophylactically. Now, a lot of doctors and a lot of dentists will say that the potential adverse effects and risks still outweigh the cost and any harm of taking an antibiotic. So they still continue to recommend just, before any type of dental care, just take an antibiotic. The thing to think about with this, though, is that when you take antibiotics often or for a prolonged time, your body starts to develop antibiotic resistance. And what this means is that the bacteria become resistant, or there's strands of bacteria that become resistant to the antibiotic. So now when a situation might arise where you absolutely need that antibiotic, the bacteria in your body might be resistant to that antibiotic it won't be as effective in treating that bacteria. So there are definitely some downsides to taking an antibiotic prophylactically, and something that should be considered when making that decision. So that's kind of where things are in terms of, do you have to take an antibiotic before any type of dental procedure? If you're relatively long-term out from when you had your knee replacement, 12 weeks, especially if you're more than a year or 2 years, then most instances you probably doesn't benefit you in any way to take an antibiotic prophylactically. It doesn't reduce your risk of getting a joint infection. If you are someone who might be at a higher risk because of the different things I described before, then it may be beneficial and may be prudent to still take an antibiotic prophylactically. Now, the overall kind of take-home message, though, is all things considered, discuss this with your surgeon, discuss this with your dentist, and listen to the advice that they provide you. They know your particular situation and circumstances and will be able to give you the best recommendations based on that. But this is just an overall idea of what the recommendations and what the thought process is that is out there. And hopefully this helped to clear up this topic a little bit for you if you are someone who has to deal with possibly having some dental procedures or dental care after your knee replacement surgery. Thank you very much for watching, and take care.